Simulated driving.
Graduate students in UT Pan Am's occupational therapy program are learning how advanced technology can monitor the performance and attention span of people out on the road with this new state-of-the-art driving simulator. The machine, purchased recently by UTPA's College of Health Sciences and Human Services, is serving as a classroom introduction to how to safely train and evaluate drivers, with a focus on researching how the elderly operate behind the wheel. The future therapist will study older adults' reflexes, reaction time, vision, and other functions as they age, and how that may affect their driving ability. They'll also be taught how to identify when it's time for the individual to be referred for a driving evaluation. Assistant Professor of Occupational Therapy, Dr. Mike Bradley, says this is a unique opportunity few universities like UT Pan American offer.
We plan on giving the students at least an introductory, as part of the older adult intervention class, where they are at least able to identify possibly, in their practice, whether or not someone should be referred for driving evaluation.
Dr. Bradley is also hoping to collaborate with local physicians by evaluating patients who suffer from early dementia or other disorders. While he says the driving simulator may not be able to determine whether it's safe for the individual to drive, he believes it will provide important data that can predict how that person will handle themselves on the road. It is also the safest way to evaluate someone's driving techniques.
It's a safe way to do a driving evaluation, because if you crash on the simulator, there's no consequences. If you crash on the road, you can injure yourself or other people.
Dr. Bradley says the driving simulator could also uncover vital information that can help educate agencies like the Department of Public Safety on how to better handle situations regarding older adults who are stopped for erratic driving. Bradley described the case of a woman who reportedly was stopped by the Highway Patrol after she got lost on her way to the doctor.
They realized she wasn't drinking or anything, and so they just gave her directions and moved on. Well, she couldn't take directions because she wasn't at the point where she could understand directions.
Bradley is excited the driving simulator will serve as a more advanced method of teaching students in the occupational therapy program, and hopeful it will provide vital information that can result in safer travel on our roads and highways. I'm Sandra Quintanilla reporting for UTPA.